Franklinton lost Mount Carmel West back in 2019. Now neighbors are getting ready to lose the emergency department that replaced it.
The hospital says that a new facility will better meet the community's needs. Kirsten Lindquist live tonight in Franklinton. And Kirsten, you've been speaking with families there. What do they have to say about all of this?
Rodney, those neighbors are beyond frustrated. Now, Mount Carmel does tell me they're going to be opening that preventative and primary care center in Franklinton to offer same-day and walk-in appointments, but that's going to come at the cost of closing the emergency room. Now, neighbors tell me that ER has been a lifeline for them for years, and they worry shutting it down means it's going to be harder to get help during an emergency. For the second time in less than a decade, Franklinton is preparing to lose a major piece of its healthcare system. Mount Carmel's standalone emergency department in Franklinton set to close in August. The health system says a new primary and preventative care center will provide more accessible and lower cost options.
We're a downtown type of area community, so losing access to care is definitely detrimental to the whole community as a whole.
In a statement, Mount Carmel says emergency departments are the most expensive point of access to care and that many patients visiting the Franklinton ER don't use the emergency services.
They're prioritizing profits over patient care and access.
Residents tell me the emergency department remains one of the closest options for care in the neighborhood. Their next closest emergency room would be Grant Medical Center, about 2 miles away. They worry sending these patients elsewhere will mean longer drives and longer waits.
Worse outcomes for patients if they're like long wait times or if they're boarding in the emergency department.
You're going to spend a good 5-6 hours in there for something really basic.
As the August closure approaches, some neighbors worry losing another emergency care facility could create a medical desert in Franklinton, leaving residents with fewer nearby options in one of the city's underserved neighborhoods.
I feel like there are other ways to repair the relationship with the public other than taking away an important resource for the community.
Now, the hospital tells me that the Franklinton Emergency Department staff will be reallocated to the other sites within the Mount Carmel system. That ER is set to close on August 22nd. That's less than 2 months from today. On your side in Franklinton Live, I'm Kirsten Lindquist, ABC 6 News.